Dear friends, we have successfully finished one case of Puberphonia today. This is our 1108th case of Puberphonia. Today is Saturday, 15th April 2023. So we are so happy we are going ahead and moving successfully in treating Puberphonia. So this is our life achievement, I can say. So last week I was very much happy that we have introduced the 10 type of voices in Puberphonia, what we are uh, getting the idea from the patients that maybe they may tell us high pitch or hoarseness or breathy voice or voice fatigue or double voice or lady voice or child voice, nasal voice, different voices or inaudible voices. So these are the 10 characters we have registered. How many cases are there? We have registered in our 1108 cases. We are able to formulate some idea. But here, today, I want to emphasize to you one more great idea. See, our aim is eradicate Puberphonia from the world, not only in Tamil Nadu, in India, all over the world. Our aim is eradicate Puberphonia because this is one of the feeling for young boys. They are tied up with a high pitched voice, a female voice or child voice. They are not able to come out of the society. So we want to eradicate the Puberphonia. But here, how they may describe to you, they won't describe it to you as high pitch, hoarseness, breathy voice, fatigue voice, lady voice, double voice, child voice, nasal voice, or different voices, or inaudible sound. They will come out with various methods. We have recorded so far from our cases. There are 32 suggestion by the boys. What they will tell. In the phone call, they will tell me, when I talk, I run out of strength. No strength in my voice. That I want to improve. They won't tell that child voice or female voice, but they are having the double voice, everything they are having, but hesitating to tell us that I am having a lady voice. Few people only boldly come and tell I am having different voice. So they simply tell, I'm not having any problem, but I am run out of strength when I talk. This is what few of my cases of 1180 cases so far I have seen. They will tell few cases, I just I run out of strength when I talk. Second point is, this is the first point. Second point, they used to tell, my voice frequently varies throughout the day. The voice varies throughout the day. When I talk with family, it is one type. Talk in phone, one type. Talk with friends, another type. So voice frequency changes. This is little educated people. We have already told that through free ads frequency app, you can record your frequency, how much you are having and all the things. So they are going on recording their voice in pitch and they are telling the frequency changes. See, this is what I want to impress all the people throughout the world. I want to have only one terminology, puberphonia. My boys are telling, you put a sex, hard voice, male rough voice, all the thing. That is only we are searching. We are not searching in names of puberphonia because we don't know the puberphonia words. But I want to reach a world where they know commonly. In Kerala, they may know heavily Maharakatta. Even all Tamilians who don't know the Maharakatta. But Ceylon people know Maharakatta means Kichukural, the boys which voice not broken. Because one of my friend yesterday came from Canada. So they have released in that one of the Tamil book there about my puberphonia. So my articles are coming now throughout the world. Yesterday I was astonished to see one of my friend Vivekanandan from Canada. He is a Tamil professor of in Canadian University, and recently he got his PhD from Anomaly University. He's a good friend of mine. So we friends were together for more than 30 years. Whenever he used to visit Chennai, he used to come and see me because he is introduced to me by one of my Malaysian friend, Sundar Rajan. He had gone to Canada. He's a good, Sundar Rajan is a good Tamil writer. And from Malaysia, he went to Canada. When he went to Canada, this Vivekananda, Professor Vivekanandan, PhD in Tamil from Anomaly University, he looked after him very well. So he only introduced Vivekanandan. So Vivekanandan used to come and see me frequently in Chennai whenever he has work because he worked in Madras University. Now he got his PhD in Tamil literature in Anomaly University. What a great man. So I pray God that he will be a number one citizen, a Tamil citizen who is going around all over in the world and spreading the various literature of Tamil. Originally, he is from Sri Lanka. So happy, 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 happy. So Tamilians are living beings with glory in Canada. So he had written an article about puberphonia, which is published in Tamil in Canada. So we had a great talk together with my Canadian friends yesterday. That is Friday. Good. The New Year day, he had come to Chennai, and he had gone to Sri Lanka for a vacation from Canada and returned. So I told him what you have done in Sri Lanka. He told me he went to Klinochi and other things, but this people are very poor only. They are having good road, but their livelihood is very poor. That's what he says. So actually, he told me he is leaving to Canada today. Today is 15th. He want to leave to Canada from India. I hope he will come. He requested me to write some more articles which will be published in Canada. But now he has actually requested me to come to Canada for a function, and I think I should go. But every day, Puberphonia boys are coming. We are treating every day because this is not 1 day, 5 days treatment. Even he comes for 1 day, we have to continue the treatment for 5 days. So every day, some Puberphonia boys are there with me. So they will be looked after me by doing some good training. Every day, good, not only good training, see, every day I am learning from them. They are teaching me what are the types of puberphonia, what are the problems. Only 1 month back, I know I learned from them that most of them are homosexual. I learned from them only. Then I have seen so many articles. What happened? Why they had become homosexual, puberphonia boys. So there are a lot of theories that we can discuss personally only, because in public it is very difficult to explain and difficult to understand, and they will understand in a wrong sense also. Okay, so I'm just writing a book on that Puberphonia boys in with homosexuality. Very soon I will try to publish it. So that work, it will come to around 200 pages. I want to do it in Tamil because most of the patients coming to me are only Indian, Tamil speaking population. They want to have an idea what will happen to us. They want in sex matter also. So purely I am concentrating on reading more about homosexuality and writing the book. Okay. Now coming to the subject, let's say mostly the boys will come and tell, I run out of strength when I talk. This is what puberphonia boys used to tell. Second, my voice frequently varies, not a fixed one. When I talk with one friend, it is one type, one relative, another type. And in a family, when I am talking, it is different. But this is puberphonic because other people, when I talk, they suspect me. They look up my body. I am ashamed. The third point is they come to know that vocal cord is the voice box major part. So they read so many books and see the Google and find out something is wrong with the vocal cord. They come and tell, my vocal cords, something is wrong. Why not you correct it? That's what they will come and tell. So I say, ENT surgeon, we should be very calm and polite because they are talking more than what we know, because they are suffering. They want to have a relief. So they will tell, something is wrong with my vocal cord, Dr. Kumaresan, why don't you correct it? Very good. I'll try to see. I'll see the vocal cord and say, everything is normal. Your anatomy is normal. But still your voice is changed, means this is called puberphonia. So that is the third point. Fourth point, my voice sound cracky, dry, rough, and lack of power. This is a many of my patients used to come and take treatment. My voice is not strong. I am not able to talk in the dais. I am not able to argue. I am not able to answer some questions with my powerful speech. They want to have a powerful speech. But when you are going on watching their voice, it will be puberphonic. They never want to express it as a lady's voice. They will say, lack of power in my voice. So that is the fourth point they used to come and tell frequently. Fifth one is, I feel as though I have no strength to produce voice. That is a very, very, very common thing. My voice is okay, but I'm not having strength to have a powerful voice. That is with that. See, most of the boys you will be surprised to know with the puberphonia voice, they will be thin and they will have lots of interest in taking food, and the weight is almost um, they will be going on reducing their weight without their knowledge, because they are not interested in the society or their well-being or their own nature. So they feel I'm having normal vocal cord. Why I'm not able to project? Because I am not having strength to produce the voice. This is what they say. Overall strength will come with only confidence. Few days back, even one playback or dubbing artist had come to me. He told me, Now I am afraid. See, I want to, previously when I'm doing the job for more than 10 years, I had a more strength. Now, when I enter into the dubbing theater, I am afraid whether I will be able to do justifiable for my voice. There's no strength in my voice. When talking, he is not having puberphonia or anything, nothing like that. But lots of confidence make him, the voice strength is less. Yes, this you have to know. I have taken a half an hour class for him, then he is happy. Male should have a powerful body voice. That's what I am writing now. See whether this will be a separate Dr. Kumaresan's theory of voice production. That's all, because the whole world is thinking in different manner. They think in different manner of the resonance. But my feeling, male voice means the whole body should vibrate. Oh, oh, oh. A-W-W-W. Oh. You can feel your whole body vibrate. Oh, hello. This is male voice. Female voice means the vocal tract only vibrates. He, he. That is female voice. Oh, he. So the vibratory portion is different. This is my theory, my feeling, that's all. Male voice, the whole body vibrates. Female voice, only the vocal tract vibrates. So only the vocal cord vibrates because of the power of the vocal cord. He. If you say he, you can palpate the larynx, stretch the larynx, and you can feel the vibration. He. But when you want to become a male, oh, that can be amma or om, oh, W-A-A, the whole body vibration. That is some Swacharya used to tell me. When they say om, not only your body vibrates, the whole surrounding will vibrate. That is what one of my friends asked me. When they want to push a bird which should strike equal strength until the last person in that auditorium hear it. So projection of the bird, male, hello, hello. So I told him this is the abdominal voice. So how to create a abdominal voice? You have to take a abdominal breathing and talk. So each time you have to take abdominal breathing, this is my theory. I will be able to explain you nicely. When you talk, how will you use your abdomen? Your voice should have sufficient strength. That means every time you take breath and talk like that, no. Automatically it will come by your manipulation. That I got 4 theories. I will slowly explain one by one in future dates. That is Newton's second law. What it suggests, I am just following, we have done a mathematical calculation for the same. We have proved we will be able to do it and we will be able to achieve. So now the patients are coming to me in different suggestions. Number one is I run out of strength when I talk. Second thing is my voice frequently varies throughout the day. Third thing, something wrong with my vocal cord. Fourth is my voice sound cracky, dry, rough, and lacking in power. So this is the four things. Fifth thing is, I feel as though I have no strength in producing the voice. So this will demoralize him in all respects. Because of voice, not only I lost my voice, I lost all my strength. Okay, don't feel like that. Voice is not only the only organ to make you strong, but if you are having a problem with the vocal cord, you will feel as if your strength is on your voice. No voice, no voice. That's all. And the sixth point, when some of the Puberphonia boys come and tell, is unpredictability in my voice clarity. My voice is not clear. I am not able to suggest the people what I want. I never want to have a bad remark when I talk. Then nice clarity in my voice is not there. What is the reason for that? That's what I want to take treatment. Puberphonia boys, they want a clarity in their voice. So the last words should be very clear. How to talk. A little magic is there. All I have learned from Umar therapy only. Eula manipulation and resonance. Resonance, it should come until the last words. It should be resonating. Few politicians, great orators, when they talk, the last word we won't be able to hear what is they are talking because it is not resonating and reaching up to the last person sitting in the dais, sitting in the auditorium. So some boys will tell unpredictability in my voice clarity. The seventh point is, sir, I try to change my behavior to sound different. All Puberphonia boys, because this is spoiling their life, spoiling their mind, spoiling their soul. They will try various methods by themselves. They study from Googling and they learn it from few doctors also, few speech therapists, occupational therapists, friends. Anybody, if you are sick, many people we used to advise them. Yes, they are giving good advice only. Many boys used to come and tell me, they push the wall and talk for half an hour. They feel the change. Because this is good only. It is not wrong. It is not wrong. Puberphonia boys, one of the treatment is push the wall and talk. Even a good article is there from Japan. Boxing relieves Puberphonia. Boxing is a treatment for Puberphonia. What do you think? Yes. Boxing, if you do with shouting and boxing, it relieves Puberphonia. Yes, good article is there which is published in ENT journal. That's all. What can we do? Yes. So if you are having a good strength in your body, with the presence of mind also, you will be able to achieve whatever the voice whatever the frequency you want in the voice. So your strength also adds clarity to your voice. Voice is your asset. Voice is your property. So the olden days I used to tell, hearing is your property. So now I have little changed my mind. Voice is your property. Voice is your strength. So they will recognize you by your voice. Voice will give you a good platform to express what you want. So express not only if you want to fight, you need a good strength in your voice. That will only bring you success in this uh, internet world. So speaking, create a clarity in your voice, you will succeed. So these Puberphonia voice, the people, they try to change their voice as they like because they want to get the voice. So if somebody advise operation also, they are willing to do. But as a ENT surgeon, I also tried surgical management of vocal cord or laryngeal framework surgery for people in my hand. By surgery, most of the cases I am not able to achieve the good result. That is why I had gone for this uvula manipulation and resonance Umar therapy, which give a correct treatment, because the correct treatment is not after so many days. First day itself. See, many of the boys here comes to for treatment for me. Until we put the thread in the uvula, they are not satisfied because they have met the doctor, nearby speech therapist, nearby great people, teachers, learned people. So they have already poisoned or changed their mind. Yes, it is inborn error. Nobody can treat puberphonia because they will see the Google and find out a proper treatment is not there. Yes, speech therapists are giving good result, but it may take long time. Similarly, surgical management framework surgery for vocal cord, larynx gives good result. But many are not attempting this surgical procedure because the success is not guaranteed and immediate. That is a problem with this. And it takes a little risk also. So many will won't opt for surgery if it is not possible by you are not able to possible to live happily. We'll try this like that. So surgical option is lost. But Umar therapy, we are not doing surgery. We are resonating it. How we are resonating? Whole vocal cord, high pitch and low pitch. There are four theories behind the vocal cord, this uvula manipulation, because we are not touching the vocal cord. The beauty of it, after our treatment, the boys will get their ancestor voice. Very nice for me. They will come and talk to me. Doctor, is it 100% success? Yes, we'll try the maximum and give you all right, because we are say, will it the voice go wrong? No, because we are not touching the vocal cord or doing any surgery, or we are not altering the existing anatomical or physical mechanism in the vocal cord or vocal tract. We are manipulation. Manipulation means holding in the hand and manipulate in different directions. It's the same thing we are doing, that's all. We are adding strength to the uvula only. So no way we are going to spoil the vocal tract or vocal cord. As such, your structure will be same only, but we are changing the direction and strength in different organs to produce the pitch. Change the pitch and make it more strong, manly. The frequency, high frequency into low frequency, resonate well. A manly voice you can get, and what more you want. That is what we are achieving by our treatment. So we'll be happily telling. But until otherwise they come and do the treatment, first instant itself they will feel they are getting the voice. Immediately success. But if you leave it, it will go back to the same thing. That is why we insist 5 days regular training, not for 1 hour, whole day training, morning to night, even in night, because we are able to give some bed for them. For this boy, they'll do a group therapy, and they will learn from other Puberphonia boys who had already got their voice. So they will try to adapt how much they are successful in creating their own ancestor voice. I will also train, and they will try, and they will get it, because this is a continuous 24 hours practice in mind and soul for these Puberphonia boys, and they will get the voice, because we are only initiating. This is a great fun. One of my not my good friend, one speech therapist from America had given a message to me. If you press the vocal cord, you can get change the, press the Adam's apple. Yes, press it. Immediately you will get the male voice. Yes, already written in books, so many books. Every book's right. If you cough, you will get male voice. Puberphonia boy, when they cough, they will get male voice. When they yawn, they will get the male voice. When they snore, they will get the male voice. It is there in their body, there it is in their soul, but we have to bring it out, and permanently we have to give the voice, male voice. That is the work we are doing by Euler manipulation and resonance. We are not doing a new thing. Already it is there in their body, which we are bringing out. Now only 7 points I have told. There are a lot of more than 21 points what we have to do. I will explain one by one every Saturday. Now try to understand the voice. We have recorded 10 type of Puberphonia voice: high pitch, hoarseness, breathy voice, vocal hectic, double voice, lady voice, or a sexy voice, you can say, or child voice, nasal voice, indifferent voice, and inaudible voice. But how the patient report to me is, I am explaining every week. So happy we have finished 1,108 cases of Puberphonia, and every day we are getting the encouraging report. So today is the 15th April 2022, and we will try to meet you on 22nd next Saturday. Thank you. Great. We'll meet once again. Great for the listeners.